Hello, my name is Michael Feldman. I'm a psychiatry PA, and today we're going to talk about natural means or food supplements that can help us deal with acute stress, post-traumatic stress. And obviously, the most common question is about marijuana. Marijuana has two most common bioactive molecules, THC and CBD. THC is the one that causes the feeling of intoxication, but also it can cause psychotic side effects and it can cause paranoia. So I would recommend not to take any substances, oils, or gummies that include THC. However, CBD does not have this effect. It would calm you down without having the side effects or the intoxication effect of THC. It can be taken as drops in oil or it can be taken as CBD gummies. Usually the dose is between 15 up to 75 milligrams a day, broken into or split into 3 to 4 doses. If you take any medications on daily basis, talk to your primary care provider about possible interactions between CBD and your medication. The other molecule that people talk about, a substance that people talk about and ask about, is melatonin. I do not like to recommend this medication because it can cause nightmares and many people complain about nightmares. However, if you decide to take it, you must be sure that you are well hydrated and you ate well, meaning that you do not have electrolyte disbalance. Usually the dose is very individual, between 1 to 20 milligrams. I know that there are providers that prescribe in higher doses than that. You can take it up to 2 hours before going to sleep, and you can start taking it with the sun down. So let's say you take 1 milligram at 5 p.m., then another 1 milligram at 6:30, and then 2 milligrams around 9:30. Ashwagandha, very popular. Indian ginseng, very popular now, usually taken in fatty foods or with yogurt or with milk. The problem with that is that many people report that instead of decreasing the anxiety, it increases the anxiety, but unfortunately it's unpredictable, and also it can cause abnormal function of the thyroid gland. If you have problems with thyroid gland, do not take ashwagandha. Also, a very popular food supplement is kava kava. If you decide to take it, make sure before taking it to do a liver function test and then repeat it every 3 months because it can damage your liver. Passion flower or passion fruit. So passion fruit can be taken 4 times a day and it will lower down slightly the anxiety, and also it will improve your sleep quality. However, if you do not have access to passion fruit, as I do not have access to fresh passion fruit, you can use the dried passion fruit flower or passion flower. It's sold in capsules and the dose is 500 milligrams before sleep. You start feeling the change in sleep quality in about 10-14 days. Valerian root works best from my experience as a water-based dilution. It's done usually at home. It's a bit pain in the neck. It requires an effort to make it. I can make a separate video on how to prepare it. It lowers down the anxiety and it improves the sleep. Other means like St. John's wort has too much side effects and interactions with medications. I do not recommend using it. 5-HTP and SAMI, it would take about 30 days, if not more, until they start working. 5-HTP can decrease the amount of sleep hours, so I don't think it's relevant in current situation. If you have questions about specific substances, specific food supplements, let me know in the comments and I'll try to respond and review them as soon as possible. Thank you very much.